Gout is a form of arthritis caused by crystal deposition within the joints. It's a very painful form of arthritis and it can come on very suddenly. Usually gout comes on very suddenly, often at night, and it usually presents as a first attack in the toe. People don't have any warning and suddenly they'll develop very, very painful swelling in the joints, often in the toe. So gout is or can be precipitated by certain diets. We know that red meats such as beef and game like venison can actually precipitate attacks of gout. A few other things like shellfish and oily fish can make attacks of gout a bit more likely. Alongside food, there's also the issue of alcohol. So beer quite often causes attacks of gout. And a lot of people don't know that fizzy drinks, carbonated drinks, can also cause attacks of gout. When gout comes on, it usually happens, first of all, overnight, and it can be extremely painful. People can often wake up with a very painful joint. They say that often the joint is so painful and so tender that people can't even let the bedclothes touch their joints. Gout, there's some very effective treatments for gout. First of all, for acute attacks, we usually start with anti-inflammatory drugs, often like naproxen or diclofenac or ibuprofen. There's another medication called colchicine, which is very good for treating acute attacks. The thing about gout, though, is that once you start getting attacks of gout, you're more likely to go on and get more and more attacks of gout in future. So we often talk about preventative treatment. That includes things like weight loss, because being overweight can make you more likely to get gout. Thinking about diet, so not eating too much in the way of red meat, shellfish, those sort of things, trying to cut down on alcohol. Those things are all really, really important. Also, thinking about other medications that people take. So there are some medications that are often given for heart disease, like low-dose aspirin and water tablets, that can cause attacks of gout. It's not always possible to change those medications, but if it is possible to switch them onto something different, then it can help with the with further attacks of gout. Moving on from that, there's some very effective medication called allopurinol, which is a clever drug that helps reduce the levels of uric acid in the blood. There are lots of medications that can be used for gout. Usually we start with non-steroidal anti-inflammatory drugs like naproxen, ibuprofen, or diclofenac, and they're often very good for treating an acute attack. If that doesn't work, we often use colchicine, which can be taken as soon as you start getting an attack of gout. And for some people, if they can't tolerate either of those medications, we actually use steroids, either as tablets or sometimes injected into the joint. If you're getting acute attacks of gout, then we would usually recommend starting a long-term medication to prevent the attacks from happening in the future. Usually we use something called allopurinol, but there's another drug called febuxostat, and both of these drugs are very good at preventing acute attacks in the future.